Okay. Okay, welcome to our talk today, um, addressing the inflammation in your diet, balancing your omega oils. This is an experiment to see whether or not we can take a live session that we did in Quincy, Illinois on Monday night and try and record it so people who don't live in Quincy can go ahead and listen to it. So one of the things that I'd recommend everybody do in real life, what we did is we had a handout where people looked on their body and drew a circle anywhere on the body that you seem to have pain or tenderness or didn't seem to work right. So what I encourage people to do is to draw an old-fashioned stick figure. You can draw like this on your piece of paper, and you can circle where you might be having pain and inflammation, or where you're just not working right. So I just got back from some skiing, and I know the left side of my leg right here is a little stiff and sore. I had some falls there. My knees are a little bit stiff from skiing. Then the other thing I want you to do when we think about inflammation, we think about pain and tenderness, but what we really don't think about is inflammation inside an organ. So if you have, again, your little stick figure, you could pretend there's some organs at different parts. If you have, for instance, have a problem with asthma, you have bronchitis, you could draw some little stars in your lungs. If you have a problem with a fatty liver disease, if you have some colitis, you have some gastritis, which is your stomach. Let's say if you have some problems with your prostate, prostatitis, any of these things reflect inflammation. Probably one of the most common ones that people don't think about is diabetes. So that would be an inflammation in your pancreas. So as we think about checking yourself under the hood for inflammation, this is where it's helpful to go back to looking at our very first slide where we look at inflammation, and inflammation is the cellular level processes that is involved with anything from cancer to cardiovascular disease, Alzheimer's disease. More and more they're finding is a disease of inflammation. Pulmonary disease, people know that. Arthritis is another common one. But autoimmune diseases and neurological ones are ones that sometimes people don't think about as much. So as we go back to look at your body here, this is where it's helpful to think about, where am I when I check in? Because oftentimes when we start to address inflammation, it may all of a sudden be kind of like a fire, and when you eat something, it might seem to get worse. So for instance, a good example would be people who have a lot of respiratory ailments. They find that perhaps when they eat a lot of dairy products, it makes their mucus secretion worse. I know myself, when I eat foods that are full of gluten, I get just some inflammation kind of feelings in my intestine. But the whole thing is, inflammation is really fire within, and it's not a good fire. It's a fire that might hurt and that might be sore. So as we start looking at the fire within, it's where we circled our bodies, but we can look at the fire outside. And this is a good example from my everyday nursing practice, where we would look at people's feet and we definitely would say, this gentleman right here, his leg is inflamed. There's lots of extra fluid going in right now. It looks like there's some inflammation right in there. And then if we were to palpate their two pulses, I bet we would find this one right here. It'd be hard to find a pulse on his right foot, and definitely would be obscured here. But this is definitely a sign of inflammation, big time. Now, when we talk about going inside an organ, this is where we look inside, and let's take our coronary arteries. This is where we build up a plaque and we have inflammation lining the blood vessel here. And when all of a sudden we would get a blood clot that would just be let loose. This is where all of a sudden you might get a little bit of obstruction right here. And that's the beginning of what we call maybe a transient ischemic attack. If it's your something in your carotid arteries, or maybe a little bit of angina in your heart. So as we look increasingly at the whole idea of inflammation, inflammation really is the root of all diseases. So as we go through and look through here, look at where it's red hot. We have our knees, we have our joints, within our rib cage, we have our brain. Definitely, when we start to think about inflammation, we want to think about, well, how can we damper it down? So to look and help you understand inflammation, I've just kind of put some of what I would call a pathophysiology side that looks at some of the things that when we do have inflammation, there's parts of our white blood cells that come to fight the disease. So you'll see there we'll have platelets come to the area. We'll have these mast cells that will come, and they make your blood vessels get bigger. They also deliver more blood plasma and cells to the injured area. And then we have our general fighting white blood cells, neutrophils, that come in. And then all of the inflammation comes with the cytokinins. They help to repair the tissue, but they also cause a lot of inflammation. And that's where our neutrophils and our macrophages work together to improve the body's response to what they call a foreign invader. So if we look at our nice fat foot that we had earlier, we can see that this person right here had increased blood flow right here. The increased capillary permeability means that the blood vessels, the little ones at the end, open up and we get all that extra fluid. So we saw that in that foot. Then when we start to see if there's a bacteria, we have all the white blood cells. Those were the neutrophils, the mast cells. They come in here and they cause the swelling. We start to then see, because they're going to our local area, they call for a host system response. And this is where more and more we get not just a localized heat, swelling, and redness, but we actually get a systemic fever. Our total white blood cells may go up. And in our talk that we had the other day, we talked about somebody who started with just a inflammation, a cellulitis in some skin in his foot, and he ended up being septic and almost dying. So when we think about the inflammation in the body, this is probably one of my favorite slides that I do when I'm working with health professionals, to understand how they need to look at different parts of their body and what kind of problems they're going to find. So we can look at the autoimmune diseases. MS is within the brain that we see with the cytokinins. The cardiovascular system, definitely this is something that I think people are really common and used to thinking about inflammation. Oftentimes, if you think about people that have just generally muscle aches, this is where we'll see it in the muscle. With the bone, you might see things like increased fragility, people getting fractures, getting osteoporosis. Some of the more common signs of inflammation in the skin are the simple adolescents that get acne that are just awful. Oftentimes people don't realize that when we have inflammation, our skin is the biggest excretory organ. Psoriasis is a good example of inflammation from autoimmune diseases coming out to the skin. We have a lot of autoimmunity with, for instance, Hashimoto's thyroiditis, where our thyroid just isn't functioning. Pretty common for people to think about lungs and looking at specifically like asthma or reactive airway disease. One of the things with inflammation that a lot of people don't realize is the whole idea of GERD and celiac disease, where people can't tolerate gluten, but basically they have an inflammatory response. We can get with our kidneys, we can get kidney failure, we can get high blood pressure because of inflammation in our kidneys that are secreting things to help control our blood pressure aren't working. And then probably the last one is the liver. We have more and more people that are developing fatty liver disease as a result of inflammation. The other thing that I just showed you here is this whole idea of when people have high blood sugars, they develop what they call AGEs. And AGEs damage the proteins. And this is why people who have high blood sugar that are pre-diabetic or diabetic have an increased risk of inflammation. And this is why people watch very carefully somebody's hemoglobin A1C, which is a common marker when somebody has to see how bad your diabetes is. So if you were going to go to your doctor and you'd ask, so how could I check under my hood? How do I know what lab work would show that I would have some inflammations? One of the most common one is the third one here, C-reactive protein. So for instance, in my family, I've been having this monitored. My father died at 64. I've been having this monitored for over 10 years because in my father's history in his family, cardiovascular disease started in their 40s. Hemoglobin A1C is something that's commonly done, and as we talk about the whole byproducts of too high a blood sugar, the glycogenation, this is where our hemoglobin A1C, we'd like it to be less than 6. If people have rising above, a lot of people like it about 5.8, which would be normal. But somebody, if they didn't have a history of diabetes, they may not be drawing a hemoglobin A1C, but this is where you might get an idea of what your fasting blood glucose is. Your fasting blood glucose should be, less than about 110. So if you're running it a little bit high, you may be having what we call some insulin resistancy, and your hemoglobin A1C may go up. In today's world, healthcare professionals are really monitoring this. Now, the serum ferritin and the red blood cell width, I will be honest, that is something that I've never had done, and it's not a common thing that you would expect people to have, but a C-reactive protein would be. So when we look at what levels would be, the American Heart Association is the one that will probably emphasize this the greatest. You'd like your risk to be low to moderate, so you'd like it to be less than, 1 would be optimal, but otherwise 1 to 2. Anything higher with the C-reactive protein puts you at increased risk that you have high levels of inflammation going in on your body. So when we look at what is the solution, when people look that they have a lot of inflammation, when they have a terrible autoimmune disease, so for instance, like rheumatoid arthritis, what you'll see people will get prescribed is a drug called prednisone. Prednisone is like the last heavy hitter. That most people, when they're on prednisone, their blood sugars will go wacky. They'll become kind of wacky and angry and crabby, and they have a tendency to get really full in the face, and they get like a humpback, and that's all due to prednisone. So the question would be, what can we do that's natural? And so Dr. Weil is probably one of the first people who came up with this. Is an older slide because it still has the food pyramid when we used to use food pyramids. But what you see, what he recommends here is at the bottom of the anti-inflammatory food pyramid, where you should eat the most is vegetables, 4 or 5 a day, fruits 3 or 4 a day. So nowadays, if we look at what the FDA recommends that we eat, we have half the plate should be fruits and vegetables. Okay, so again, same story as Dr. Weil. So that message is an anti-inflammatory message. We know we've been encouraged to eat more beans and legumes, whole grains. Here again, anti-inflammation. The one area that I find that people have the hardest things is eating the fish and seafood. And here we want 2 to 6 times a week. And we want wild salmon, cod, sardines. These are areas where sometimes people have a little bit hard. And we're looking for the omega-3s that come in that. Same thing with the healthy fats, the virgin oil, extra virgin olive oil, walnuts, avocados, all have what we call healthy omega-3s. So if we look at a shopping list of what you would do, I like people to think about what they can do. So green leafy vegetables, nuts every day. I personally recommend almonds and walnuts, berries at least twice a week, beans, whole grains, fish at the minimal once a week. So with the anti-Alzheimer's diet, what they really recommend is quite a bit more of all of these things, because people are at increased risk for inflammation due to that would lead to Alzheimer's disease. Now, I'm not usually telling people what not to do, but you want to try and limit. Instead of having a 12-ounce steak, could you go for a 4-ounce filet when you go out to dinner? Limit yourself to butter and stick margarine 1 tablespoon a day. Cheese less than 1 serving a week. To give you an example, where I was just recently, they had cheese at every meal, and 2 or 3. So definitely fried or fast food, less than 1 serving a week. So these are things that you can think about. So how could I decrease my inflammation by, instead of doing these foods on the right, is do these foods on the left. I am a Dr. Sears certified health coach, and this slide has been probably one of my favorite slides that has shown people 16 superfoods that I'll say, okay, in the next month, how can you figure out how to get these foods into your diet? Again, some of the same foods that are in the pyramids that we've talked about, the salmon, the berries, the nuts, the olive oil, specifically broccoli, what we call our cruciferous vegetables, our tomatoes, pomegranates, flaxseed, red onions. So how can you work to try and get that into your everyday diet? I've had challenges in workforce where everybody would bring one of these in, and during the week, everybody would get an opportunity to try some of the different superfoods. But sometimes it's easier when people are trying to improve their diet to concentrate on, okay, what's my short list and where can I find it in the store? So my recommendation, this is a slide from an intervention I did with my brain trauma awareness organization, where we went go fishing, and we went to the grocery market here in Quincy, Illinois, and looked for some ways that we could find economical sources of fish, specifically salmon. And our Hy-Vee store has some great examples there. The other simple thing that we did, that I do with people, is try and think about an oil change. So instead of getting rid of the things on the left with the butter and margarine, is going to the extra virgin in a dark bottle with an expiration date, the olive oil. Simple things that you can do, that you can start by going to the grocery store. The other simple thing that you can think about doing is perhaps exploring the idea of supplementation. Now, we talked about the big push with omega-3s is fish. And here's what I've had somebody tell me to do. They said, you know, people have been telling them to eat all those healthy omega-3s for a long time, and they feel really, really bad because they don't want to do it. They've started recently on the omega blend supplementation, and what they like about it is they don't feel guilty anymore. What's neat about this omega blend is that it is non-seafood. Personally, I myself, with my family history of cardiac disease, was really reluctant to do fish oils. All I heard is that, you know, there's some lousy products out there, you belch them. So I tried to do dietary changes instead. But what's interesting about this product, the new Omega Blend that came out with Juice Plus, is that it's made from vegetarian sources. It's a vegetarian capsule, and it has a blend that's perfectly found in nature of omega-3, 5, 6s, 7s, and 9s. And it comes from the pomegranate seed oil. Remember, pomegranate was one of the foods I told you to eat. We had raspberry berry. If we look at sea buckhorn, it's runs and grows wild. Tomatoes were on the list. Algae oil and saffron seed oil, all which are high with omega-3s. And if we think about what the problem is with people's diet, is people have a problem with oil in their diet by it being omega-6s right here. So this is naturally sources of how it forms in nature. It's not from fried food. So if we look at what the advantages of an omega diet is, increasingly more and more, I've heard people who have been recommended by doing omegas for their eye health. And I've heard interesting stories of people telling me how their eye and vision has improved. One of the things that we know definitely with omegas is that they really do decrease the inflammation. And as we talk about decreasing inflammation, as you look back at that original picture that I had, inflammation is what the cause is of almost a disease in every part of the body and every organ. So it makes sense that if I got a better amount of healthy omegas in my diet, it would decrease and have an effect on any part of your body that would be having inflammation. So one of the things that I tell people, when people have inflammation, oftentimes they may have more pain. And so they may treat that. I know myself, I just noticed as I was getting a better blend of omegas, I seemed to have less pain in my life. And it came on kind of slowly and gradually, but it's due to inflammation. My knees didn't feel tight. They didn't feel red. And so when we look at what is in the omega blends, for people who are allergic to fish, I traveled for 10 days with a girl who's allergic to seafood very, very badly. And she actually, when she goes into any restaurant, has to ask people to tell the chef that she is allergic to fish. Because what I didn't realize is that a lot of cooks use fish oil, of certain kind of fish oil in a lot of different salsas. And so it is a really dangerous. She walks around with an EpiPen. So she has been a good example of somebody who's just like, oh my gosh, a healthy omega blend that I can take finally, because she wouldn't be able to do and follow the dietary recommendations. This is just a blogger site that I thought was very interesting. If you like to look at websites, looking at what are best markers for inflammation, and here is very much what people, when they have an autoimmune disease, you'll see they may have CRP levels greater than 10. Specifically, this is with more severe immune disorders. The Medical News Today had a really good article on inflammation that I thought people might be interested in sharing. And then if you're used to cooking with some different things, there's some herbs that you can try. Ginger root is one. You can buy fresh ginger root at the grocery store. Cinnamon, clove. Cinnamon, in fact, supposedly, anecdotally, there's not some high-level studies, but some people I've known have taken cinnamon capsules to help decrease their blood sugar. One of the common ones that a lot of people use is turmeric. I know my massage therapist, when I was in the midst of having a lot of inflammation, she recommended turmeric both in my foods, and I had some tea with turmeric, and I had some capsules with turmeric. And so here again, you know, they're safe to enjoy in food, but again, if depending on what other medications you are, you should always check to see, with some of the different herbal medicines and plants, whether or not they would interfere with some of the medications that you're having. And it's mostly to do with the metabolism of those drugs. So really, even your pharmacist would be a good one to ask. The other thing that they're not out yet is vitamin D, whether or not I recommend for people from the whole idea of osteoporosis and breaking bones, because especially where we live, there's a lot of elderly people. Once you break a hip, it kind of changes your whole game plan. So more and more healthcare providers are surveying people's vitamin D. And vitamin D3 is something that more and more people might take. I know myself during the summer, I get plenty from being outside for at least 15 minutes a day. But during the wintertime, it's implicated with higher latitudes. People who are low in vitamin D have an increased risk of multiple sclerosis, in fact. So as we look at what you can do to take control of the inflammation in your body, what I would encourage you to do is get kind of like a check to see a body check where you are. Think about, can we get rid of some of the foods that limit these here? And what can we do to include more of these? Here is a nice grocery shopping list. If you want to take a picture of this and save it on your cell phone and go grocery shopping with it, it'd be a great way to do it. I've had a lot of people to do that. Or the other thing that more and more people are deciding to do, that indeed taking an omega blend is a good first simple step as they work to try and change diets. I have worked with my brain trauma awareness organization for the last year and a half to work on improving our diet using the Mediterranean and the Mind diet, which is some of these same slides that I've used with them. And what I have found is that people have been very poor at making simple changes. This would be a good simple change to decrease your inflammation and look to see how it affects to get your body to a healthy baseline. Get rid of some of the foods that are causing inflammation in your body. One of the best things that I tell people to do is go on, get rid of all this for a week. There's a Shred 10 diet where you shred all of the things that are bad for you. Do that for 10 days and then let some of the dairy products, gluten, sneak back in. And oftentimes you will find all of these little symptoms that you had right here in the beginning on my little body here, all of a sudden they snuck back in again. So what I would encourage you to do, if you're here listening to this call today, if you'd like more information on the Omega Blends, if you'd like some information on the Shred 10 and as another approach to decreasing the inflammation in your diet, please contact whoever sent you this recording today, and I'll open this up for any questions that we might have today. Do I have any questions from anybody who's here today? If I don't hear anybody on today, thank you for coming today, and I look forward to, feel free to contact me, and we can discuss more in detail. But do think about what would be a simple step that you could do today.